Hey everybody, so I am officially 28 weeks today, and the most exciting thing about that is officially, doctor-wise, book-wise, I am in my third trimester. So it's a really exciting milestone to make it this far, especially in a twin pregnancy. You know, there's a lot of people who maybe don't quite go this far, or they've maybe had some complications. So I consider it a big victory to have made it this far, and it's very exciting. Just like every week, the two apps that I have kind of disagree on the size of the babies. My One Pregnancy Plus app still says the babies are roughly the size of a papaya. They're supposed to be between 13 to 15 inches and a little more than 2 pounds, maybe like 2.2 pounds. And then my What to Expect app this week says that they are the size of a head of cauliflower. And they also say the range for weight is right around 2.5 pounds. But just like normal, everything this entire pregnancy, both babies have been measuring ahead of time. Excuse me. And I had a doctor's appointment yesterday, and both babies are still measuring ahead of schedule. So baby Caleb, our little boy, is measuring he's actually measuring at 30 weeks, which is just crazy. Even the doctor said that he's very big, but not in a bad way. It's very good. He is, according to however they scale the weight, he is 3 pounds 6 ounces, and baby Lila over here is measuring at like 29 weeks and a few days, like 29 weeks and 3 days or something like that. And she is weighing 3 pounds 1 ounce. So they are still relatively close in weight. This has been the furthest they've been apart as far as ounces. He's 5 ounces more than she is, but the doctor wasn't concerned about that. She said it's totally normal. It will continue to fluctuate possibly, but the fact that they're both over 3 pounds is a really good sign, and he's almost 3.5 pounds. So again, they are way ahead of what the books and these apps are saying, and for a twin pregnancy, I don't think that you could ask for anything better than that, because if there was to be any kind of complication and they were to come early, you know, the bigger the baby, the better. You want more weight on them, you know, for many reasons. And so it's a really good thing. He's in the 84th percentile for being 28 weeks, and she's in the 74th percentile. So they're still on the big side, which I'm happy with. Everything else has been going well. I mean, the appointment went well. The babies look good. Everything is going well. I feel good in the big scheme of things. I feel gigantic and I feel achy. I get really achy in my hips and like my inner hips. In the morning, especially, I think it's just from, you know, laying in a certain position for so long. It hurts so bad that I sometimes am like, I'm not going to be able to walk for a few minutes. Just moving my legs and lifting my legs if I'm in a sitting position or laying position is actually really hard. My hip flexors are super tight. So that's one thing I'm definitely looking forward to, stretching all of that back out once I'm not pregnant, because it's very uncomfortable. I know I mentioned in my last video that sleeping has become kind of a thing of the past, and I had a friend message me and kind of give me some pointers, and it was really helpful. What she said that she did when she was pregnant is her and her husband would lay back to back, and just having that extra support on her back made a big difference. And although Chris is going to be gone in training and we can't really do that, I have found if I take a really long pillow and kind of tuck it up underneath me, like underneath my back and like my butt and thighs, it actually provides a lot of extra support. So that has been significantly better. But I still move back and forth from side to side, and I just get uncomfortable. If I'm on one side for too long, my hip starts to ache, so I have to roll over to the other side. I get heartburn all the time still. And And lately, my newest thing has been the swelling of my feet. At first, it was just mainly, you know, by the end of the day, just from, because I work at home, so I have a desk here that I sit at, but just from sitting, my feet would be swollen. But more often than not, this last week or so, my feet are just randomly swollen any time of day. First thing in the morning, they're usually not swollen, but after that, it's pretty much guaranteed that I have some sausage toes and some cankles going on. Most of my shoes don't fit. I have Uggs that fit and I love wearing them, except we live in Texas and Texas weather is very hit and miss. It's almost 80 degrees today, so wearing Uggs is really not a good option. I did find an old pair of sandals that thankfully are still a little loose. And actually I had stopped wearing them because they were too loose and they didn't fit, but now they actually fit. So I have those, and I ordered another pair of like stretchy material, like flip-flops. That way I can hopefully wear them. We'll see if they work. But yeah, my feet are pretty swollen. I usually sit downstairs with my feet propped up on a pillow. And that does seem to help, but that's been my newest thing. But other than that, everything is good. I will say a few weeks ago, and when I hit 24 weeks, I did talk about viability, and I was mistaken in that video. I had mentioned that at 24 weeks, the chances of survival for them was 90%. I had misread whatever it was that I had read online, and that wasn't correct. So basically at 24 weeks, the chances of survival were like 30 to 50%, something like that. And so now officially at 28 weeks, their survival rate, if, you know, they were to come early, is at 90%. So I was a few weeks off. I can't remember what it was that I was reading that told me that, but so that's exciting to know that, you know, we've kind of hit that milestone as well, that if they were to come early, the chances of, you know, something catastrophic happening is very low. And then the other thing I'm doing this week, or starting, is my kick counts. And I know I mentioned that 2 weeks ago or something. We had been practicing for a little bit, making sure I can kind of tell the difference between which baby is which. But it's a little harder because now, after my appointment, the babies are in different positions than I thought that they were. So we're going to have to tweak a few things. I just want to make sure I'm actually feeling the baby that I'm supposed to be feeling and that I'm marking down on my list. But basically, I'll show you. So here's my belly. Caleb is over here. He sits on this side. He's still head down, but he takes up this side. And then Lila used to sit across this way. She was transverse, but now she's moved this way, but she's breech. So her head is here and her little feet are down here. So now I have to figure out, when I'm feeling kicking and movement, who it is, which is fine. It's not going to be crazy hard, but it's just got to figure that out. So, but here's my belly. 28 week, yeah. I have been getting comments from people who ask, you know, oh, how far along are you? And when I say I'm only 27, 28 weeks, they're like, they have this look on their face. I'm like, oh, well, I'm having twins. And then they're like, oh, okay. It's like kind of a sign of relief. I think people are surprised at how big I am. And then when I tell them that, yeah, I'm only 7 months pregnant, 8 months pregnant, whatever it is, they just are like, holy cow, she's huge. So that's kind of been funny lately. But anyways, that's my update this week. Sorry, I'm out of breath. That's also something that just happens. But yeah, hope you guys all have a great week. And I can't think of anything else to say, so I am going to go. Have a great day, and we'll talk to you guys later. Bye.